You are listening to the Body Charge podcast, and I'm your host, Sandy Sanderson. Welcome to the Body Charge podcast. Today's topic is the natural bladder doctor's tips to treat incontinence. Urinary incontinence is surprisingly common in women at various stages of life, including pregnancy and in the later years over 40. Many suffer in silence due to embarrassment, or they're advised on strategies like pelvic floor muscle exercises and Kegels, which don't always work to fix the problem. My special guest today is Dr. Nigel Brayer, an expert in natural medicine and women's urinary health. He developed the Iron Clad Bladder System, a drug-free treatment for urinary incontinence that combines neurological insights with traditional Chinese medicine, helping numerous women find relief from this condition. So a big welcome to you, Dr. Nigel. Thank you for coming onto the Body Charge podcast.
Yeah, thank you so much for the invite. I appreciate it, and I look forward to sharing some information.
My first question is, I'm very curious as to what drove you to specialize in this particular area.
Sure. You know what, Sandy, it's very interesting. Accidents seem to be the best drivers because I didn't plan on doing this. I've been in practice 28 years in the natural health field, functional medicine, chiropractic, acupuncture, and I've treated everything from chronic pain to digestive issues to ADD, ADHD. But what kind of drove me to this was my wife. It was after our last child, Jude, who's now 7 years old. She just started having problems that she didn't really want to share with me, which was kind of distressing. But we've always been very active as a family. We've skied and biked and ran and all these other things, and she just really stopped doing a lot of those things. And I didn't really understand why, because she had the energy and whatnot, but she was really embarrassed to share that she was having bladder incontinence. And it wasn't till some probing, it took quite some time because she had avoided doing a lot of things that we love to do as a family. And she was embarrassed because she couldn't actually hold her bladder. And that started to kind of press me to start doing some discovery. And then once she had shared her issues with being able to hold her urine, is I realized as I looked and started treating more patients, and as the universe works, is when you notice something, things start appearing, which I find very curious. And then I started noticing a lot of my other patients had the same issue, but they had failed to share. So I reviewed their health history, and I realized a lot of my patients had checked off those boxes of urinary incontinence on their health forms, but I'd actually never really acknowledged it. So I started doing some research. And so I hate to sound selfish, but it was purely a selfish motive. I wanted my wife back, and I wanted to be able to run and ski and bicycle ride and jump on the trampoline and all these other things that we love to do that over many, many months she had just stopped doing altogether. So I thought, well, there has to be a reason. And through my research, obviously, there's several different reasons, which we can talk about later, of course. But that led me to kind of discover that this is extremely common problem that very few women discuss and very few women actually address. So, as you may have noticed on television commercials, is panty liners and adult diapers are becoming a big business. And if you
Yeah.
look into it, it's surprising that it's a huge business that nobody really cares about. And it's because most people just quietly purchase them and they think that the only option is to use a pad.
Yes, so they're embarrassed, and understandably so. It's
Sure.
interesting that your wife was embarrassed because, having a doctor as a partner, how convenient is that? Wouldn't you just tell them everything that's going on? Yeah, so that was interesting.
Yeah, and I guess that's another curious thing is there's so much stigma associated with that is people think that, well, a child can hold their bladder and they're 3 years old. Why can't I? And so even as a partner, there's embarrassment. And then as a physician, there's even enormous amounts of stigma that most ladies don't share it, even with their trusted doctor, their gynecologist, their OBGYN. And that's why most of the time they just manage it kind of in the shadows.
Yeah, it's also interesting. So you mentioned children. So in my experience, so young girls and young women tend to be able to hold their bladder much longer than males. Um, so I don't know why this is, but it's just something that I've observed. Um, what do you think the causes are with the development of incontinence with women? Is it due to childbirth or other issues? Um, what are all the different kinds of reasons that we may develop incontinence?
Sure, Sandy, that's a great question. There are main types of incontinence, and then there's subtypes, but let's make it simple. The two main types are stress incontinence, um, and urge incontinence. So stress is really, as it sounds, is the pressure's too great and the musculature can't seem to hold it. And we can talk more about this in a few moments, but that's purely related to the muscle intensity. And that's very common in athletes, especially young women athletes like volleyball players and Olympic athletes and such. The incredible amount of intra-abdominal pressure that occurs, that's the pressure from jumping and breathing and tightening your abdominal area. And then urge incontinence is very curious because that has more to do with the neurology of it. And that's really what my Iron Clad Bladder System is mainly focused on. So stress incontinence is based upon is the sphincter. So a sphincter is a valve. So just like a valve for a gas pipe, you turn the valve, things shut off. So stress incontinence is based upon musculature. So you've got what's two main muscles. You've got the levator ani muscles, which are the ones that control around the valve. And then you have what's called the detrusor muscle, which is the muscle that in the bladder. So I like people to think about bladder as a balloon, and inside the balloon, like the area where you would blow, there's a straw. And so a male straw obviously is a lot longer. That's called the urethra, and a lady's straw is much shorter. And so on the two ends of the straw that goes into the balloon is called the internal sphincter or the internal valve. And then the straw that on the end that goes outside of the body, that's called the external sphincter, which is the outer part. But a lady's is very short. It's probably about an inch and a half long. And a male's can be, vary in lengths, but it's longer. So what's interesting is that muscle is almost 80% what's called unconsciously controlled and only about 30% is consciously controlled. So what does that mean? Well, the unconscious control of your body, if you think about what's beating your heart right now, Sandy, is that your subconscious mind.
Yes, the
Your
autonomic
subconscious,
nervous system.
correct.
Yeah.
So it is beating your heart and you're not thinking about it and you don't really care. If you need more blood supply right now, it's going to increase that blood flow without you worrying about it. Well, what's so interesting is over 80% of the valve of the bladder is unconsciously controlled. So it's based upon unconscious patterns. Could be stress, it could be anxiety. And I was reading on your website, which is very fascinating, is you talked a lot about stress. And so stress has a huge impact on the entire body, but of course, the autonomic nervous system, the sympathetic versus the parasympathetic,
Yep.
which is the fight or flight component, which is I'm protecting myself because I'm going to die, or I have to protect myself in some way, or my parasympathetic, which is I'm going to heal and restore and build. So most people, especially moms, are under a high, what's called sympathetic dominant load. That means their body's used to being under fight or flight all the time. And of course, that's going to affect the bladder and it's going to affect those valves. So unconsciously, those valves don't have great control because they're under the stress response. Does
So,
that
so
make
you,
sense?
yes, so you can have
Yeah,
like the muscles working quite fine and strong enough to hold, but the urge or the message, so it's a messaging system, isn't it? And
correct.
when the autonomic system kicks in and moves into sympathetic mode, which is fight or flight, that high stress, such as in a trauma, if someone is in a trauma, a car accident, or some kind of dangerous event, they can just wet their pants there's nothing wrong with the musculature of the bladder or the urethra or anything. It's the psychosomatic autonomic system, isn't it? It's a psychological thing where the signaling is I'm in danger and evacuate. So it could also lead to a diarrhea event. So everything is just let go in that trauma event because I think the body wants to make itself lighter so it can flee from the danger. Is that the way it works?
Yes. And then also is it goes back to long-term stressors create general tone. So let's go back to your earlier question, is younger versus older. Generally, younger people have a much smaller long-term event pattern that they're, let's digress. Our body responds to patterns, trends. So most North American, most first world nation people are very high stress. So their body is already primed. And then you add in children, you add in age, you add in nutritional deficiencies, you add in hormones, and the body is very disconnected. So that's why the real long-term solution comes from reintegrating that nervous system. So supplements have value, nutrition has value, but the nervous system is really trained. So I think of it like a piano player who's been taught inappropriate muscle memory. And then a master piano player says, hey, you're doing it wrong. And somebody now has to teach their hands how to play differently than they've ever experienced before. That's very difficult because you
Right.
have these muscle memory patterns.
To
And the
retrain
bladder
bad
is no different.
habits.
Correct. And so that's quite a process. So that's where when we brought in our Iron Clad Bladder System, it's really built upon retraining that nervous system. Kegels are awesome. Pelvic floor stuff is useful. But at best, you're only dealing with 30% of the problem. What about the other 70 to 80%? Well, that's neurological, and it's much more challenging to address. That's why medical treatment primarily is based upon. So if a lady goes to her medical doctor for any sort of treatment, they're going to start with beta blockers, or they're going to start with antidepressants, or they're going to start with some sort of muscle relaxer to relax the tissues in the pelvic area. Well, that has nothing really to do with the actual problem, but they recognize too that it's a neurologic problem, but they don't have a lot of options at their disposal. So they do their typical beta blockers and antidepressants, which makes sense of why it gives them some help, but it's not actually a solution.
Yeah, so calming the nervous system with drugs is a very short-term bandage. Look, and it may be in an acute situation something to fall back on. And that depends on, how the doctors assess the situation. But long term, like an ongoing lifestyle program, is really not ideal because all of these medications have side effects that tend to get worse over time. The problem isn't being solved. It's like taking an aspirin to fix the pain, but you haven't fixed the problem causing the pain, right?
Agreed. So it gives some temporary relief so that that's where I can see why people would make that choice because it helps them immediately. But the underlying problem is left to continue. It's like a cycle that builds and becomes larger.
Yeah, so it's interesting too that when we're under great stress, especially chronic stress, we tend to dump or lose a lot of magnesium via the urine because it's used excessively under stress. And includes athletes, people who put their bodies under great physical stress, or shift workers when they're fighting sleep. They should be sleeping when they have to be awake. That's a great strain and a stress on the nervous system. So there are many reasons. It's not just psychological stress or, the loss of a partner or something like that that makes us feel sad and depressed. It can be any kind of stress, too hot, too cold, too noisy. Anything that stresses the body ramps up the use of magnesium because it's directly related to metabolism. So we don't get enough from food. A lot of people know that by now. Industrial farming leaves the soils quite depleted. So it's pretty well impossible to get enough magnesium orally via diet when you've been under stress for a long time and you are in a great magnesium deficiency state. And as magnesium drops in the cells, calcium starts to become more dominant and it moves around the body freely and settles into soft tissue and joints. So this is what's interested me because, I've had people come to me also with issues um, to do with the bladder, always getting also infections because
Sure.
when the tubules become stiffer, they can't, the valve doesn't work like it should, doesn't close properly like it should. Everything's like a little bit stiffer from the calcium deposits. And, this can also mean that bacteria may backflush and, they can get infections. So can you explain a little bit more about that kind of scenario where what would you do in your protocols to help that person maybe decalc a little bit?
Sure. So that's a great question. So as you've noticed, nothing is isolated. So when I talk about the nervous system as the key component of the bladder function, we also have to look at the bigger picture. So when I explain to a patient, we talk about three main causes of stress. So there's physical stress, which we can talk about, which could be the bladder, the mechanics of the bladder, the levator ani muscles, and the strength or weakness of that, or the tightness. We can talk about the nutritional, chemical, hormonal effects, which we'll talk about in a second. And we can talk about the mental, emotional effects. So there's really three key stressors that we all undergo all the time. So we look at all three of those no matter what the problem is. So in relationship to the bladder, we have to understand is deficiencies are going to create imbalance, not only in the bladder, but in all tissue. So we could just as soon be talking about a chronic digestive disorder right now, is if you're not digesting and you have an IBS, irritable bowel type syndrome, or a Crohn's or a gastritis, which is inflammation of the lining, all these problems are intertwined. And so if I'm addressing a long-term or bladder problem, we're going to teach people how to reintegrate that nervous system. But we also have to just to make the differentiation that nutrition, balance, magnesium, calcium, magnesium dumping, calcium excess, all those are a part of the bigger picture. So, but to most people that becomes extremely overwhelming. So what I like to do in terms of patient management and care is to give people something they can see results with right away. Because you and I, Sandy, might know, because this has been my life for 28 years, is it's much bigger than just this tiny little peep through a peephole. There's all these things that intertwine. So I like to give people simple tools that they can make big changes with right away, get some benefits, but that opens the door to say, hey, well, what about the nutrition? What about the lack of magnesium? What about the digestive disorder that's preventing you from absorbing? What about your protein imbalance? What about your hormones? So
Goes
not to
back
get
to the
complicated, but they're
goes back to the autonomic system as well, because your digestion also works without you telling it what to do.
correct.
Um,
And
yeah, so everything works automatically as far as the vagus nerve and the digestive system goes. So when we have stress, it all tightens up. And what happens with tightness, the calcium moves in, and so things don't work. The signaling may be affected. So the interoception, so you mentioned before about the urge or the perception of the urge to go to the toilet may not be there, may be dysfunctioning because the messaging system is kind of stuck or clogged or blocked. Somehow the electrical nervous system isn't sending the messages through like it should. And as you said, nutrition plays a huge part in everything, especially magnesium and the electrical nervous system. It directly suppresses adrenaline, so we feel calm straight away. And it's important, yes, in your strategies, I understand, to work quickly, to alleviate the stress quickly, because then you can move to level 2 and level 3 and do more long-term things as well. So can you explain a little bit more about your standard protocol?
sure. So the standard protocol is simply we have people do an assessment. It's an at-home assessment. It's a series of questions, and it really helps people isolate where their biggest issue is. Is it stress incontinence or is it urge incontinence or is it both? And in my experience, it's usually both. But what that does is that opens the door to start taking focus of where I'm going to put my energy. So what we do from there simply is our protocol is based upon stimulating key acupuncture points that stimulate part of it's the vagal nerve, part of it's the governor vessel and the conception vessel in acupuncture. Part of it's an exercise to help again is the pelvic floor can be too weak or it can be too tight. And so part of our protocol is going to be to stretch and to strengthen that pelvic floor, as well as start to build a practice to balance out the autonomic nervous system. So I don't like to use the word meditation, but it helps us become present with our body and it helps us to stimulate the vagal nerve, helps us to balance out the autonomic nervous system, and it helps people to start to put um, their intention and focus into those areas of balance, which would be the pelvic floor, the bladder, and vagal nerve and autonomic nerve function.
Yes, and may I add a little tip that if you drink demineralized water, it goes through the digestive system too quickly because cells need electrolytes in the water to take up the water better, in particular magnesium. It gives it the right charge for the cell membranes to open. So then, because you get a more thorough hydration in the body, that water goes through the body a bit more slowly than if it didn't have the minerals. That's another little tip.
Absolutely. That helps the kidneys too to keep it inside the circulation versus dumping it out. Absolutely.
Yes. Yes, so a lot to learn about the autonomic nervous system. I think, we need more research and more study and more movement of these strategies into mainstream so that every doctor knows to check and to, advise people of at least the basic protocols, how to live well, longer, naturally, and not go straight away to a drug therapy, which may in the end cause more problems than it's worth.
Agreed, Sandy, is that's unfortunately, and again, I'm in North America here and people here are very drug orientated. But what I'm excited about is most people have started to realize that a lot of the benefits are very short term with some long term negative effects. So I'm excited that people are starting to become self-aware and realize that doctors are good doctors, but they're trained by their interest and they're trained by the people who teach them. And so I encourage patients to start really being aware that they are their best advocate. They care about themselves more than anyone else does. So do some research and definitely ask some questions. And if it doesn't seem right, then you should probably look elsewhere.
And yes, people need to think of their body, I think also not just like a robot, like their car, like a mechanical device, that the body can regenerate, can relearn new things, can be retrained and reconnected to do what's in the DNA program. If we release the blocks, if we can move that system back into equilibrium. And that's what it's all about, isn't it? Trying to find that balance with every person, what the compensations need to be to bring them to a steady state. And so if someone has had a trauma or an injury or an operation that may affect their incontinence, so that's a little bit of a different kind of an intervention rather than, childbirth or, wear and tear.
Sure.
Are these protocols that you have able to alleviate to some extent someone who has those other kind of maybe surgery issues?
Sure. No, that's a great question. And as you spoke that, I had a few patients that came to mind. One I'm thinking about in particular, she's in her middle 60s and she had a complete hysterectomy. She had ovarian cancer, um, and she has just a myriad of scar tissue in her um, pelvic floor region. So I met her, this was probably a few years ago, but she had really severe incontinence for over 8 years. And when I met her, she felt hopeless because of all the scar tissue, the trauma, the surgery, the cancer, the radiation. There's just a lot of stuff. Um, and so she went through our protocol. It went over 16 weeks. And she was doing the protocol 3 times a day, which took about maybe 4 or 5 minutes. So what's that? 4 times 3, she had 12 to 15 minutes a day. She had a 70% reduction in her incontinence. She literally would go through 5 or 6 adult diapers a day. Now she's down to, she can usually get 4 to 5 hours without any problem, and she that allows her to go grocery shopping and do some social things. So I guess the question is that we have to remember is the body's design is to heal, pure and simple. Even if there's trauma, and so we'll have people say, hey, I'm 95 years old. If I go to the gym, is it going to help me? And the answer is yes. Now, will it help me the same way as it did when I was 30? The answer is no. So the question or the statement is you can always get help as long as your body's alive, but you may not always get where you want to go. So this lady in particular, is she perfect? No, but she's 70% better. And of course, we track this in our protocol with our daily tracker process. So these percentage improvements are based upon her input, not mine. And so that was a life changer for her, especially since she expected it to get worse, not better. So
That's
yes,
fantastic because it's also a great cost saving on all those diapers. Let,
understood. And
let alone the embarrassment and you know how much it holds people back into disability because they can't go out shopping, as you said, for a few hours or, you know, out to lunch with friends. Yeah, and I think you're doing a lot of good work, and I really appreciate you coming on the Body Charge podcast because this is great information to share with others. You know, it can be embarrassing to talk about, so it's probably something that, you know, family members or friends need to um, treat very carefully and sensitively. And
understood
and
and
perhaps
agreed.
refer them to your website, you know, third-party doctor website can be helpful to get past the embarrassment. So can you let people know where people should go to find out more?
Sure. Yeah, you can simply go to Dr. Nigel, Nigel, Brayer, Brayer, .com. And there's several, there's at-home health tips, there's foods that help your bladder, there's things you can do at home on that website. There's a plethora of information. Um, so yeah, check it out. And if you have any questions, just reach out. I'd love to share. The biggest thing that I want people to know is most people think that their problems are unique, and I've been at this long enough to know that it's not unique at all. And sometimes that in itself is very inspiring to people because just knowing that you're not alone is really a big deal, and it also opens the door to dialogue. So
Yep.
yeah, I just encourage people to look and not accept.
Caring is sharing or vice versa.
Yeah, understood. Yeah, and that's a great quote.
Nice, nice. Well, thank you so much. I really appreciate the interview. And we may be able to do something in the future again. And feel free to check out electromagnesium.com.au, where we specialize in transdermal magnesium absorption and we can bypass the digestive system altogether, which is very effective for many, many people. And you can't make a mistake because the body's self-regulating through the skin. It just is like a dinner plate. You serve up
Yep,
the nutrition in that reservoir, and the body picks it up as is needed over an amount of time. And so everything can be individualized that way. And there are no contraindications, so it's only got pluses.
awesome. Yeah, magnesium is amazing, amazing mineral. And that's part of the key plan to everybody. They should all be taking magnesium. 100% agree, Sandy.
Yeah. Thank you so much.
Appreciate
And
you.
Merry
Have a good day.
Christmas.
You too. Thank you so much.
Bye bye.
Bye bye.